Hello, good day, Mrs. Mergay Subdulia O. Amok, RN. My name is Joshua Go from Bachelor of Science in Nursing. I am here going to return demonstrate the crutch walking. What is this? Now we have following another procedure is a gait achieved by a person using a crutches. If the person an injury, the gait may be selected and learned, which is determined by a physical functional abilities of your patient and the diagnosis regarding to the doctor. And then what are the purposes of this procedure? There are four purposes of this procedure. It improves the balance of your patients and the lateral stability and facilitates the mobility and activity for the patient, and which make sure also to increase the self-esteem of the decreasing the dependence. And then we have to decrease physical stress on weight-bearing joints and unhealed skeletal injuries. For the materials that are needed in the procedure are, you need an appropriate crutches with make sure that a rubber tip to avoid pain, okay? And then also check for the tip, okay? So next one is we have the safety belt or gait belt, which is this is optional if the client can move it. And then you have your shoes, and then you have your comfortable clothes which you are going to use in walking. And then, as a nurse, we are following the basic guidelines of the nursing process. We follow the assessment, planning, implementation, evaluation document. Okay. And then for our procedure proper, so we have to do is assess first, like the checking by assistance of the doctor or checking for the doctor's order for this procedure, walking in the crutch. Assess also the following, which is the reason why the patient needs to crutch. Now, we need these crutches. And then the client's physical conditions and limitations. Also, we're going to check for the client's physical environment. No, maybe safe for him. The client's ability to understand and follow directions regarding using your crutches for walking. And then determine the amount of assistance needed while the patient is using the crutches. And determine the length of the time and the patient use the crutches. And then for our planning, make sure to be prepared to shorten the walk of your patient, and then according to the person's activity and tolerance, and then prepare to strengthen the muscles. This is how it is done every procedure in this one. So for our quadriceps setting position, we have to, first one, we're going to need to ambulate first, no? Prepare to strengthen the muscles, need for ambulation. Contract the quadricep muscles while attempting to push the popliteal area against the mattress and raise the heel. Maintain the muscle contraction for a count of 5, and then relax for the count of 5 also. And then repeat these exercises for 10 to 15 times hourly. And for another planning, no, for gluteal sitting position, contract or pinch the buttocks together. Same at the count of 5, relax for the count of 5. Then repeat this 10 to 15 times hourly. Prepare to strengthen the muscles of the upper extremities and shoulders girdle. Do the triceps muscle. For flex, then extend the elbows with a fully flexed shoulder while slowly holding dumbbells or weights to increase the strength and endurance, or do push-ups while lying in a prone position. So this is how it is done. We have the finger flexors and wrist extensor. Like you would squeeze the rubber ball to increase grasping strength. Push-ups while lying in a for pectoralis major while prone position, or do abduction and adduction of shoulder while holding the dumbbells on supine position to increase your strength in holding the axillary bar close to the chest. For latissimus dorsi, sit-ups on the bed or chair by raising the body from a chair by pushing hands against the seat of the chair or mattress to increase the strength in the forward movement or propulsion of the body during crutch walking. Raise your body out of the seat and hold and relax. Like this. For the abdominal muscle, raise the head and shoulders from the bed. Mid-ridge with hands bedside to the body or across the chest to strengthen abdominals in supporting upright position. And for measuring for the crutch on height, no, use a tape measure to when the patient is lying down or in a supine position. Instruct the patient to wear the shoes until he will be using for the walking. And number 2, measure from the anterior fold of the axilla to the sole of the foot, then add 5 to cm or 2 inches of measurement to appropriate crutch length. And then when the patient is in standing erect, make sure that the patient is patient against the wall with feet slightly apart and away from the wall. centimeter or 2 inches below the axilla as points of B, and measure this point to mark second as point A. This measurement approximately or the crutch length. And then determine the patient's height, then subtract with 16 inches from 40 centimeters. This measurement is the appropriate crutch length. And then make sure the last one is to gather your equipment and materials to help save time, effort, and energy. The procedure proper, wash your hands. Make sure to explain the procedure to the patient, emphasizing that it may take time to learn the techniques, that to stress safely and the importance of moving slowly initially when providing an explanation include like demonstration, then assist the client to shoes that are comfortable. Make sure that non-skid, hard sole, and low-heeled. Assist the client in a comfortable clothes. Measure the client for correct crutch fit. Make sure also to lower height of the bed when the lock of the wheels, and then slowly help the client into a sitting position, and then assist for any dizziness, faintness, or decrease on orientation. Then you can also apply safety belt. This is optional, and assist the client in with maneuvers like appropriate for the type of gait and with other general crutch walking techniques. Demonstrate the correct technique for the type of gait to be used before the client gets out of the bed. Then you can begin demonstrating of the gait technique from a tripod position with the crutches 6 inches to the side and side inches to the front. Boarding for the 4-point gait, this is how it is done. Advance right crutch, then left foot, then the crutch, then right foot. This one. And that's it. Another procedure for the 3-point gait, advance both crutches and expected extremity at the same time, advance an affected extremity. This is how it is done. For the 2-point gait, advance right crutch and left foot together, then left crutch and right foot together. This is how it is done. Swing to swing through gait, advance both crutches at the same time and swing body forward to crutches past them. Then demonstrate the correct techniques for walking up and walking down the stair with crutches. For walking upstairs, stand behind the client and slightly to the affected side. Place both crutches on the same level as the feet. Now advance the affected leg to the next while bearing down the crutches handles. Pull the affected leg and crutches up to step while bearing weight on the stronger leg. For walking down the stairs, stand one step below the person on the affected side. Place both crutches on the same level as the feet. Shift weight to a stronger leg. Lower the affected leg and crutches to the next step while bearing down on the crutches handle. Advance an affected leg last. This is how it is done. Now I'm going down. Then we have the demonstration of the getting out of the chair. Must have the armrest or secured branch against the wall of the essential for clients using the crutches. So in getting out the chair, stand with the back of the unaffected leg centered against the chair. Then you can transfer the crutches to the hand on the affected side and hold the crutches by the handbars. The client must grasp the arm of the chair with the hand of the unaffected side. Lean forward, flex knees and hips lower into the chair. Then in standing up or getting out into the chair, move forward to the edge of the chair and place the unaffected leg slightly under or at the edge of the chair. Grasp the crutches by your hand, and then bars into the hand of the arm of the chair by the hand on the affected side. Then you can push down on the crutches and the chair armrest while you are elevating the body out of the chair. So this is how it is done. Then lastly, after that, you can assume a tripod position before moving or walking. So this is how it is done. Then observe the return demonstration and help the client practice until proficiency in the crutch walking is attained. Wash hands and properly store the equipment. And for our evaluation, we're going to evaluate the client's tolerance and reaction to the procedure, and then assess if the client is able to demonstrate and safe independent ambulation with assistance of crutches. Assess if the client feels confident while safe using the crutches. Also document all the following client's chart like gait pattern used to crutch again, the height of the crutch, maybe fit for him or her, steadiness of the gait and amount of assistance needed, and distance by the walk of the patient. Just make sure your plan to shorten the walk to avoid any problem or tiredness. And then there are some important points to remember while using the crutches. The first one is during the crutch use, make sure that the body weight should always be borne on the hands and not the auxiliary bar. And then there should be 2 finger width. Make sure this one. Insertion on the auxiliary fold and auxiliary bar. A foam rubber because it's painful in the axilla. Pad over the auxiliary bar will to relieve pressure because it can cause decubitus or thoracic cage or can cause other problems. And then balance. Make sure that the balance from the patient will be optimal and always maintaining a wide tripod sustenance or the stance, even in the resting of the stance. And then what is tripod stance? It is the basic crutch stance for balance and support, which is achieved by placing the crutch tips about 4 to 6 to the side and front of each foot. And then also number 3 is to maintain a tripod position before doing any crutch gait. Then the auxiliary bars should be held close to the chest wall, which provide improved lateral stability, and the elbow should be flexed 20 to 30 degrees during the crutch use to observe the impact during the crutch ambulation of your patient by adjusting the height and the hand piece. No? And then have the patient wear well-fitted rubber shoes with firm soles during crutch walking. And then help a tip to the crutch tips will dry and clean to maintain the surface friction, number 7, no? And then to prevent slippering, and then keep the crutches dry to clean, maintain the surface friction, and I'm doing it, that's number 8. And then make sure that the fitted large rubber suction tip to prevent slippering. And also prevent to become wet. Dry them all before using. And the number 9 is the nurse should stand posterior lateral to the patient's weaker side. And lastly, number 10, important to remember, is the patient must maintain a erect posture as possible to prevent strain or muscle joints pain and to maintain the balance always. So that will be all. Thank you so much.